All right, it seems that we're good to go. Thank you for your patience and apologies again for the little delay. It's my honor to welcome all of you and to wish or welcome you to today's webinar. First of all, of course, a very regular good morning, good evening, and good afternoon, since we don't know where you're joining us from, but we're very much pleased that you're here with us, joining us at the Prevention Gone Wrong, What We've Learned the Hard Way. And today's event is hosted by UTRIP, WFAD, and Drug Free America Foundation. And as you know, we do have interpretation available. So below you can see the interpretation button. You can either select English channel, or if you would like to have the Spanish translation, you can select the Spanish channel. And also feel free to introduce yourself in the chat, your name, your organization, and which country you're from, you're joining us. So we're very much happy to see you engaged. And also throughout the webinar, you always can ask questions to the panelists, which will then be discussed in the Q&A afterwards. So today's theme, as the title is already, clearly saying, it's about prevention, and the theme is both timely and important. Earlier this year, the Commission on Narcotic Drugs, a new resolution on prevention was adopted, with the full title being Promoting Comprehensive Scientific Evidence-Based and Multisectoral National Systems of Drug Use Prevention for Children and Adolescents. And it's very encouraging to see that prevention continues to be recognized and prioritized at international policy level, but it also raises a lot of important questions, of course. What does evidence-based really mean? And what makes prevention really effective? And how can we ensure that this powerful tool, which when implemented correctly, can save lives and reduce enormous social and health costs, but actually works as it is intended? Because as we know, even well-intentioned efforts can sometimes be inefficient or even counterproductive. And over the years, prevention science has become more and more advanced and researched. And we also have gained a lot of more tools, such as the UNODC has developed the International Standards on Drug Use Prevention, which was first published in 2013, which contributed to a strong foundation to prevention science. But also more recently, Matej Košir has further contributed to the prevention science, but also more to the translation of science and practice by launching his book, which explores methods that might seem effective at first glance, but upon closer examination can have the opposite impact. So today we are very joined by an excellent panel of experts who will help us unpack what prevention really is and how we can implement it effectively and what actually works based on research and practice. So as said, please feel free to post your questions in the Q&A box or in the chat, as we will have enough time towards the end of it. So without further ado, I would like to introduce our first keynote speaker, Matej Košir. He is the Director, Institute for Research and Development, UTRIP, from Slovenia. He is the current chair of the Vienna NGO Committee on Drugs, and he's been working in prevention advocacy in the field of substance use and other risk behaviors and addiction for about 25 years. And he's, as I shared earlier, he is also the author of the international book, Prevention Gone Wrong. Matej, the floor is yours.
Thank you very much. I'm very happy to be part of this exciting webinar because, and first, of course, good morning, good afternoon, good evening, good night, wherever you are in this world. And I'm really delighted to welcome you to this webinar based on my already mentioned book, Prevention Gone Wrong. Today, many of you already read the book, so many of you already are aware of the book and the content. So today, I want to share some of the lessons we have learned in prevention the hard way, because I didn't explain anything easy in the book, only those things which we learned in the past the hard way. So the mistakes, some myths in prevention, some missed opportunities. But don't worry, this isn't just about pointing fingers on the wrongdoing in prevention. It's about learning, also laughing a little bit, and moving forward together. So this, before I get started, let me make a quick disclaimer. Everything I will say today, it's not entirely my fault. If you want to complain, here you have a list of different organizations. You can send them your complaints and frustrations as well. So I'm just, you see the list is long, so just start complaining if you wish. In other words, don't shoot the messenger. I'm simply very proud to be a messenger and advocate for evidence-based prevention, evidence-based policy as well, and minimum quality standards in prevention. So keep calm. It's actually their fault, not my fault. So we can still continue to be friends after this webinar. And now I know what some of you might be thinking, that who is this guy and why should we listen to him about him talking about prevention? So just to reassure you, I do have some credentials. These are the few awards and recognitions we have received in recent years, not because I want to look smart or important, but simply to prove that I might be good enough to say something meaningful about prevention. Think of this slide as my, don't worry, I'm not a random person off the street, guarantee. But honestly, these awards don't belong only to me. They represent the amazing colleagues, networks and organizations I have had the privilege to work with. So prevention is always a team sport. Also, there is a quite long introduction, my own introduction and acknowledgements in the book. So if you open my book, the first 2 or 3 pages are about acknowledgements to all of these who contributed actually to my career, to my professional development, and also to the content of the book. So just a little bit to set the scene. When we think about prevention, expectations and reality often do not match. Policymakers, professionals, and the public frequently hold overly simplistic views. Prevention as a quick campaigns or isolated activities, and in reality, prevention is far more complex, multidimensional, and requires long-term investment. When we start in prevention, yeah, this is my reality as well. I can tell you from my own experience. When we start in prevention, we think it's going to be a smooth bike ride straight to the success. Easy. Not really. Reality looks more like this at the bottom, like storms, sharks, wild animals, even volcanoes sometimes. So the truth is that prevention is bumpy adventure, not a straight line. And that's exactly how we learn the hard way. So we learn all these things I'm trying to explain today and also in the book through this adventure with a lot of different barriers on the way. So let's start a little bit with some humor, with some fun. Although it's not really fun in reality. So in my book, I describe one of the more unusual prevention strategies I have come across, inviting rock stars or celebrities or some important, very well-known people from the community or nationally to talk to children about drugs. So imagine Marilyn Manson giving prevention advice in school. It's hard, really hard to imagine, but we constantly do similar activities. So sounds like a bit like asking a fox to teach chickens about security. So these examples remind us that prevention is often built on good intentions. But as we'll see, good intentions are really not enough. Most people who work in prevention mean well. That's the fact. I wouldn't say that we do ineffective or harmful interventions intentionally. So I'm not that. I don't want to be that sarcastic. So I always believe in people. So I think that 99.9% in prevention mean well. So they want to protect children and young people. But prevention isn't about how much we care about kids and youngsters. It's about how effective we are. So effectiveness is not equal, satisfaction with some activities or liking something. It's not equally also effectiveness. Good intentions don't automatically translate into good results. So without evidence, prevention can even backfire. So what usually goes wrong? We see a lot of the same patterns everywhere. This is a global phenomenon. It's not just, speaking from my Slovenian perspective or European perspective, but we see this kind of activities and this kind of interventions all over the world. So fear-based campaigns. These shocking posters that may grab attention, but rarely change behavior, if at all. Simple slogans like just say no, they're catchy but ineffective. Celebrity talks that inspire for a day or maybe two and are forgotten the next days in the next days. And also short-term projects that look good in the report but leave no real impact. So I call this the fast food of prevention. They look tasty at first, but they don't nourish. And what should prevention actually look like? It should be long-term and consistent, not just one-off. Should be evidence-based, not based on guesswork. Should be developmentally appropriate, meeting children and young people where they are, and also don't leave them there. Of course, if they need any other support and help furthermore. And deeply connected to families and communities. This is also very important to know. Whenever we come with any intervention to schools, to different settings, should be connected with a wider community and also including families. So think of it like planting a tree. You don't just throw some seeds on the ground once and walk away. You water it, nurture it, and watch it grow. It is the same with prevention work as well. And also, let's talk about some numbers and the costs. So it's not just doing something ineffective or harmful, but it also could cost us a lot. So when we get prevention wrong, it's not just harmful and ineffective. It costs not our personal budget, but it costs community, national budget, family budget. Many budgets are involved in this. It wastes valuable resources, but not just money, also time and trust. It leaves practitioners frustrated and communities disillusioned. And most importantly, it leaves young people without the support they deserve. So prevention done badly is not just ineffective, it can be also very harmful. But here's the good news as well. So we actually know what works. Although we are not doing that, we know what works. So we should switch more often to this kind of activities. So evidence shows us that life and social skills programs work. Family-based programs work. Well-structured school programs work as well. And community initiatives also work. Environmental prevention strategies sometimes even the most, because they set some social norms, some norms in the community if we regulate things in a effective way, like alcohol policy, tobacco policy, some other policies like cannabis policy as well in some countries. So such as evidence-based policies also are included in our work, not just working in different settings, but also advocating for better regulation and legislation. So actually, it's not really a rocket science. when we speak about prevention, evidence-based prevention. But it does require some commitment and discipline to follow the science. I like to sum up this in 5 pillars of effective prevention. First is building life and social skills. Second is strengthening family and school bonds. Third is engaging young people as well as active participants, not just the passive target population. Ensuring long-term and structured strategies and adoption and consistent implementation of evidence-based policies, including school policies, just for example, and already mentioned alcohol, tobacco policy best buys, for example. Together, these pillars can support healthy, resilient young people and stronger communities. And what lessons we have learned the hard way? So number one, we should stop repeating the same mistakes. If fear campaigns, for example, didn't work in 80s, last century, they won't work today as well. And number two, let's actually learn from each other's failures and not just smile politely at different conference when we meet each other. So in short, prevention gone wrong teaches us how to do prevention right. And my challenge to all of you today is this. So move from good intentions to evidence, passion and action could still remain in our prevention work. I think it's also very crucial that we show some passion, show some emotions, show that we care about our target population. And action, of course. I mean evidence-based action. So prevention is not about looking good in the media, which sometimes is the objective of some not maybe professionals, but at least policymakers in the field of prevention. But it's about making a measurable difference in people's lives. So I ask you, what you will do differently in your prevention work after today? I believe that many of you already do a lot of evidence-based work. So this question is pretty much for those who still keep doing some ineffective or harmful stuff. So let's just promote a little bit also my book. So in my book, Prevention Gone Wrong, I dive deeper into these stories, lessons, and solutions. It's very practical, as I heard from different professionals. It's evidence-based, and yes, sometimes it's a little funny. We can learn more. You can learn more by scanning simply a QR code here. Or visiting the website of the book. And I hope it will inspire you to rethink prevention in your own work. So this is the QR code. Just in case, it will be also on my last slide. So if you missed it now, don't miss it in the last slide. Just to close, I want to leave you with this thought. Prevention isn't about being perfect. So nobody is perfect, not even some of us the seniors in prevention work. But it's about making the effort and striving to do a little better every day. So this is the message. And if we can combine honestly in how we work, a little humor to keep us humans, and science to guide our decisions, then I truly believe we will get there sooner or later. So that's how we build prevention that actually makes a difference. So thank you for joining me on this journey. Prevention is too important to leave to chance or slogans. Let's rethink it together with science, with passion and with collaboration. I'm looking forward to the discussion also from perspective of different panelists and to hearing your perspective as well. So we are waiting for your comments and questions in the chat. So thank you very much. And Cressida, please, I give you back the floor.
Thank you very much. Thank you for highlighting the essence of prevention, but also that prevention is you know, as you said, it's evidence-based, and so many times we do it with good intentions and we believe that it is evidence-based, and then we don't continue maybe learning and improving our input and implementation of programs. And I think learning is something that we always need to do wherever we start and whatever program we do. So thank you for highlighting that. And it's not impossible. I think we can learn from each other. The advantage of being a global platform and being connected here today is as well that we can actually learn from each other so easily. And even though we need to always, of course, culturally adapt everything that we do, we can learn here with each other and from each other. So I'm sure there will be a lot of questions later on. But first, I would like to give the floor to our panel because we are joined by three incredibly important experts and persons in the field, I would say. And as I mentioned earlier, like Matej already talked about key pillars in prevention, but another three key pillars that I would like to highlight is that we often talk about is the science that guides us in prevention, the policies that are required, and also support the implementation of prevention, which is then also the third pillar at the same time, the implementation that brings the prevention to life. And while these might always seem like separate processes, they are very much deeply interconnected and they also reinforce each other. So therefore, it's very much an honor today to be joined by panelists representing each of these three essential dimensions, helping us explore how together they can make prevention stronger and more effective. So with that, I would like to introduce our first panelist, which is Dr. Diana Denny Fishbein. She is a senior neuroscientist in the FPG, the Child Development Institute at the University of North Carolina, and she directs at the National Prevention Science Coalition to Improve Lives, which works to translate knowledge and best practices from prevention science to public health policies. And the list goes on, but I don't want to take too much time of your speaking time. So please, Diana, the floor is yours.
Thank you so much. Let me get myself together here. Go away. Come on. Okay. All right, perfect. Everything good on your end with my slides?
It looks perfect.
Okay, great, thanks. So I am going to try to represent the science adequately to support the points that Matej has made that are so critical to understand, because so many people really don't know what prevention science is. And when I say not you all, obviously, but the decision makers, the people who have the ability to systematically deliver the interventions and the practices and the policies that can really benefit people in our communities. And so it's very important to understand the science base for this. And because of that, I'm going to just review a little bit of what many of you may already know, but for those who don't, I'm trying to move this and it won't move. Sorry. There I go. You can't see that, can you? I put your faces over the slides, so just as long as you can't see
the
it.
first slide.
Okay, good. Okay, so it's important to recognize, because, and so I'm just going to do a little bit of review that, you know, prevention science is a 40-year-old field. And many people don't realize that. And it has generated just an absolutely substantial amount of knowledge and best practices. And Matej has pointed that out very competently in his book. It's based on a very solid framework and rigorous methods in the field of prevention science, and literally hundreds of evidence-based programs and policies and practices have been very well tested and implemented and shown to reduce the risk factors and to increase protective factors and conditions that promote health. And therefore we know a lot about how to prevent pathways to substance use in the first place, and certainly escalation to more serious substance substance use disorder, and dependence. So we want to be able to continue to use these practices rather than continuing to rely on strategies that are unproven. And in some cases, they're iatrogenic, they're actually detrimental. And so that really seems like a fool's errand to continue down that pathway. And it's very ineffective, it's very cost inefficient, because the science is there to help guide us to develop and implement effective programs that can be delivered equitably and ethically to address communities' needs and map to their cultural preferences and values and needs and demographic backgrounds. So, and if we were able to do that, we could avoid stigmatizing people, we can avoid thinking of substance use as a moral failing, and we can better appreciate the challenges that people have who begin to use substances and spiral down the course of pathways to substance use disorder. So quickly, as I said, I just wanted to kind of review to make clear what goes into prevention science. This is just a summary, of activities that prevention scientists engage in, and each one is conducted at all levels of a prevention model. So identifying risks that can be reduced, protective factors that can be strengthened, developing and assessing effectiveness of programs and policies that emanate from that basic research, and then developing best practices for implementation, which is where many times things fall apart because there's not good implementation in place, identifying optimal means for disseminating and scaling good interventions. And then finally, what I've added to this, because now prevention science is engaging more in talking with policymakers to inform them of the science. And so to me, this is a very central obligation and responsibility of prevention scientists to speak to those that are making decisions for us in our communities. This is from the National Academies of Sciences, Engineering, and Medicine 2019 report that I think nicely points out that there are a lot of effective programs and policies to prevent behavioral mental health problems. They occur across all of these different genres. These are not specific programs, but they're sort of genres or categories of programs that occur across the developmental lifespan, and they get larger and larger as you get towards the bottom, where you see that they can have population effects through community interventions. And if we can engage with policymakers to have policies support the delivery and the fidelity and the monitoring and evaluation of these programs at that policy level, then we can sustain and scale what we know works. So along those lines, because there was so much knowledge, I'm trained as a behavioral neuroscientist, but I've really gravitated towards the field of prevention science my entire career, because we know so much about what's impacting our brains from social conditions that are malleable. So we know so much, but who's going to translate that evidence to policymaking? And so we developed this National Prevention Science Coalition to Improve Lives about 11 years ago. It's become a very large organization. We have thousands of members. We reach tens of thousands of people, and we talk to Congress. We do briefings, basically to take, and so much more. Please see our website. But we really want to take that body of knowledge that is languishing there, without books like Matej's, without these kinds of interactions with you all, it is not being used in a way that could truly benefit our entire country. Let me not say our entire country, obviously. We've got people from all over the world here. I'm used to speaking to American audiences, and we need it everywhere, and it applies everywhere. So one of the areas that I focus on, because I'm interested in prevention, is neuroprevention. And that is a field that is really informing and really escalating, advancing what we know from prevention science so we can be more effective. Because we know the brain is plastic. We know that every condition, every experience, every exposure that we have, not only throughout development, but into adulthood and beyond, is that the brain is plastic. And for the worse, it means that adverse childhood experiences can alter the brain to lead to behavioral and mental health problems. But for the better, what we know is that there are neural systems that can be reinforced and strengthened to support healthy attachment, socialization, adaptive learning, and self-regulation. And it emphasizes, and I love this because prevention is very steeped in this principle, it emphasizes the importance of nurturing caregivers and nurturing environments on brain development. And so I'm not going to go into this model, but just to give you the gist here, sorry for the animation since I'm rushing a bit, but we know that there are interactions, there are effects of the environment on genetic predispositions through environmental exposures that we call epigenetic modifications. And so that is the point at which prevention science has the greatest potential to make a difference, because environmental factors can change the way our genes are suppressed, ending up manifesting in these intermediate phenotypes that we see in the brain, the structure and function of the brain. And that leads us to different kinds of behavioral orientations, self-regulation, aggression, cognitive control, attention, and so forth. And that configuration of how that looks, these intermediate phenotypes, how they look, ends up in affecting the liability threshold for whether people, and it moves across time, how people are vulnerable to substance use disorder or other behavioral manifestations. But the point of this model is that every stage of influence here is an opportunity for intervention. We know that children need to reach their developmental milestones before age 11, which is crucial to risk for substance use. So it's very important, like we think about prevention of opioid overdose. Well, what about, trying to prevent the pathways there in the first place? We have to act early. We have to make sure that our environments are nurturing and optimized in a way that children can function to their potential. And in doing so, we need to attend to children's developmental milestones. That's very much part of primary prevention of substance use disorder. We also know that it's not too late in adolescence because the brain reorganizes in adolescence. It's a very dynamic period of development and is very vulnerable, if you will, susceptible to environmental influences. So it's very important to strengthen what we call top-down control, the top of the brain over the emotional centers. And there are ways of doing this through ensuring that kids have met their developmental milestones and that they're not exposed to adversity. When they do not receive the nourishment that they need from their social environment and their connections and so forth, the prefrontal cortex may not connect well to lower centers. And because of that, there's not as much impulse control. There's not as much goal-driven behavior. There's poor stress reactivity and so forth. And so we can end up with these behavioral problems that often lead to substance misuse. This is just, I love this figure. It's just a great figure showing the different kinds of environmental adversities that can impact the process of brain development and behavioral outcomes. So there's positive stress, which I haven't even mentioned, but that's the positive experiences that can overwhelm these toxic stress conditions and their effects on the brain. And because children who are exposed to trauma are very much at risk, have a very higher probability of substance use disorders, we really need to attend to these kinds of conditions, which are ultimately very malleable. So stress acts at the level of the brain where in the same areas, the reward systems, the motivation systems that are activated during drug abuse. And so it's very important that that become a point of concern for us and that we address that through prevention, that we reduce these traumatic stress exposures. So we've learned a lot from neuroscience that applies to the field of not only prevention science, but prevention practice. And it helps us get to a more holistic model of intervention policy and practice in the ways that I have outlined here. And I'm happy to share these slides because I know I'm going terribly quickly. But what it helps us to do is understand the external conditions that are conducive to the problems that we want to prevent because of their actions on the brain. And we also know that well-timed interventions can enhance the way the brain develops and have an enduring impact on critical points during development. This is the way we feel, or we are beginning to understand how prevention works by strengthening these brain controls over emotional centers. We also know that we can change the brain in adults. So imagine the extent to which we can change the brain in childhood and adolescence when it's so much more malleable. And just to end, despite all this knowledge that we have, and this is just, you know, a drop in the bucket, just to point out what some of the issues are, this science is often overlooked in prevention practice. Also, very little of what we do know reaches the public and private sectors. All of these systems and more have been relatively unaffected by prevention science, public health, education, child welfare, criminal justice, where they stand to benefit and have population level effects. And that there is potential for, instead of relying on vested interests, lobbyists, and feel-good programs that Matej mentioned that have no evidence of their effectiveness, let's do actual prevention science that's steeped in evidence in the data. And I apologize again for talking so fast.
Thank you so much, Diana. That was a wonderful presentation. And even though it was a lot of information to process, I think it was very much well structured, that it's very clear as well. And thank you for pointing out the importance of the environmental and as well as the trauma that is often also overlooked. That we kind of forget that trauma has such an important impact in the brain development. So that is also mentioned in prevention, as well as that it's never too late. It is important to start early, but it's also important not to give up later in adolescence. So thank you so much for enhancing that. So not to take too much time away, I will continue to our next speaker, Wadih. Welcome, Wadih. He is the coordinator and team lead of the global program on prevention, treatment, and rehabilitation section of the UNODC, and he has 20 years of experience in the field of social and health response to drugs with UNODC. So welcome, the floor is yours.
Thank you very much, Cressida, and thank you for all your effort as World Federation Against Drug and the work that you're doing. And thank you for Matej also for organizing this event. It's a pleasure joining you, and thank you for that book also, Matej. While there's a lot of prevention science books and articles that exist, sometimes that middle layer in terms of passing this knowledge to everyone, I would say, that is remotely interested to know what prevention is, may it be a teacher, may it be a parent, may it be a young university student, or may it be a professional working in the field. Even myself, you know, there are lots of nice examples that I can use, could use a platform like this. So that being said, it's very nice to follow what Danny was saying in regards to the science of prevention, to shift to another context, which is how the international standards are supporting countries to move from slogans to actual evidence-based work. That's my job in the next 5 minutes, and I have no slides, so I'll try to be as brief as possible just to give you some insight in terms of what we found so far. We have not seen any sort of hesitation from seeing what Matej has described, the passion of doing prevention in any country. I mean, everybody is interested in prevention. The main problem was, actually, like the point of advantage being that it's a comfort zone. Prevention, everybody should do prevention, and there's a lot of prevention, but there's a lot of instances where there's no respect that there is that science that Danny has mentioned before in what we're doing as prevention. So how can we harness that momentum to make it respect that science that moves forward? And this is where there are, I will summarize everything I want to say in 4 points. So the first point that we see is the diversion and the point of focus. Most policymakers, their concern is the drug, and their assumption is like we're addressing drugs, and everything they do is centered on the drug when we say drug prevention. Meaning that in that context, all the arsenal of responses orbit around providing information about the dangers of drugs, raising awareness about it, talking about this danger, fear-based messages, or providing more information about what they know about it in terms of these chemical structures and beyond. So it's information-based in its nature. So that moves to that shift of thinking from the perspective of the drug being the problem to the person, like Danny mentioned, that's all of these developmental milestones that happen in terms of decision-making processes that are complex and go way beyond just lack of information, particularly in this day and age where information is not only at the click of a button, but rather like, digested information from many sides through artificial intelligence can be provided and shape norms, require much more intensity of work and much more depth than information. So this moves to the second point, not only the point of focus, but even the way the business of doing information, of policymaker is need to be revised. And this is where there is even science in providing information that is not being respected. So it's also important to focus on policymakers to understand who are they talking to. What is normative beliefs? Is it only lack of information, or there's like things that are shaping social norms right now that go beyond information about drugs that need to be addressed, and who's influencing? What is the level of, whether or not if I'm at a certain age, I'm belonging to the majority or the minority of the people if I use or did not use that substance? That's addressing these social norms, the critical thinking. How can I convince these people through information? Is giving information enough to change the perception about the harms of a substance? Perception of harm is a self-reflection. So there has to be some critical thinking within me. So that perception, that interpretation of information is important. How can I raise that expectation? And this answers one of the questions that I saw in the Q&A by Laura Edwards in terms of scare tactics. Do they work? Well, it depends how things are interpreted. And, it's not like this is providing information does not necessarily translate into change of perception. A simple example is in the field of smoking. You go there, it's not like the information is secret. Actually, the information from the ministry in terms of the danger of the substance is printed on the actual box with the picture of the person and all the information on it, and you buy it with the information. It is not the deterrent. There's something that goes beyond this that needs to be accounted for. So that's the second important thing that we're trying to do, even within the context. It's not like dismissing that awareness raising is not important, but there's something beyond this. The third thing is telling them that there are many things when we move into the developmental perspective that Danny mentioned about that reflects there are so many interventions that do not discuss drugs, but support the developmental milestones of the individual that you're not considering in your prevention technique. So you're losing so much on the things you're already investing in with a few fine-tuning to approach it to the science can be more supportive than investing only in awareness raising. So you're investing in it. How can you move forward? How can you capitalize on this? And that's a very essential thing that the prevention standard is providing to the policymakers. That perspective of moving earlier in ages of development, focusing on things that work beyond just awareness, and how can they capitalize on infrastructures that they have. Before they move to the fourth and most important thing is after they do this, in terms of capitalizing what they have, investing in what really fills the gaps in their systems of prevention. So they have to work multi-sectorally, right? And then after they capitalize on what they have, they identify things that they are missing at certain ages of development, in certain levels of risk. There are certain interventions that are for everyone at the age of development. There are certain things for people that are living in higher level of vulnerability than others. They require selective intervention. There are some that have symptoms that need to be addressed before they escalate into something more complicated. And this is indicated prevention. So when you segment all of this, you identify where you need to invest in order to ensure that you don't leave anyone behind when you're investing in a system of prevention. And that's the fourth and most important part of this thing. And all of these are mediated to the prevention standards. So if I want to summarize, prevention per the standards goes way beyond awareness raising and fear arousal. It does not rely on the assumption that it's a free personal choice that a person can say yes or no, like a multiple choice exam. You want to do this, yes or no. There is something way deeper than this happening in the decision-making processes at the individual level and at the contextual level around that person. The point of focus should be that person in their ages of development. Prevention is multi-setting. There is no way in a developmental perspective that one institution can carry the burden of accompanying that person from birth onward. That's why we say it takes a village to raise a child. And it has to start early. The earlier we start, the more we can impact the developmental trajectory of the children. And then the most important point, when we move to a kind of a person-centered approach, that vulnerability has a much higher return on investment than raising awareness only. Because that same vulnerability, or these protective factors that we're reinforcing, so we don't always focus on the negative things that are leading to a decision-making processes at one point in life to use drugs, are the same that are linked to other sort of negative and social health consequences. May it be violence, may it be crime, may it be mental health, school delinquency. So the return on investment from that perspective is much higher. And that's why we are pushing for a much better investment and to avoid prevention in all the good intentions and all the good passion to go in the wrong direction. And this is where there's a small element that I would have probably changed in the cover page of Matej's book. It is not always common sense. So common sense and science should be there, but it's not any common sense that a policymaker would have, they should put in place. Prevention is more than common sense. So I leave it like that, and I pass the floor back to you, Cressida, for the rest of the panel's discussion.
Thank you for passing it back to me with such a strong statement. Yes, thank you for highlighting that, especially the last few points. As you said, it's not always about awareness raising. It's very important, but it's not the only thing. I think your example, which you gave with the smoking package, is very visualizing, and that's so much that you don't even relate to that so much if it's not pointed out. So definitely that. Thank you for pointing that out, and also the fact of the protective factors, how strong they are if we actually focus on those in every stage of life of the child, from young to adolescence as well, and that no institution can do it alone, no organization can do it alone. It has to be a whole comprehensive system of care. So thank you for pointing that out, and I'm sure we'll hear more from you also during the Q&A. Without further ado, I would like to introduce our final speaker of the panel, but not the least at all. We're diving into the implementation section of this panel. It's my pleasure to introduce Carlton Hall. He is the president and CEO of Carlton Hall Consulting LLC, a full-time service consulting firm providing customized solutions for communities and organizations with over 25 years of experience in substance abuse prevention and community problem solving. The floor is yours, Carlton.
Cressida, thank you so much. I can't tell you how excited I am to be here, to be a part of this panel, and to be a part of this conversation, this very important conversation. It's extraordinary. I'm here on the screen that I'm sharing with actual heroes of mine. I have an extraordinary and profound respect for the folks that have spoken before me today, and a profound respect for many of you who are in the audience. Many of you are heroes as well. I'm so gratified by being here. I want to just share a few moments and want to thank Matej for organizing this and for providing this really, really important resource. I think all preventionists should have access to this book, because it provides so many great keys for us as we are attempting to kind of move through our lives and apply the principles that we've discussed today. I'm going to share a few moments just in terms of how we take the remarkable science that Denny has shared and the incredible guidance that the standards that Wadih has offered really apply to implementing this within our real world context. How do we think about this? What do we consider? And one of the things that I've learned in my experience, I've had the great and extraordinary privilege of working in every state in the United States and many counties throughout those states and in many countries around the world. And so seeing how do you take prevention science and apply it in various cultures and contexts, and what are some of the lessons from this has really yielded itself to help me understand this from a different perspective. And I want to start off with this illustration because I think it kind of really encapsulates what it is that I want to try to offer here. Many of you, I'm sure, are very, very familiar with this navigational system that I think many of us have become really dependent upon. I know I have. I think this is one of the greatest inventions that has taken place in this century. I can remember the very first time I got into a car and did not need to know how to get to where I wanted to go because this lovely female voice came on and was giving me directions throughout, telling me when to make a right turn, when to make a left turn. And I knew if I could just trust that voice, I would get to my destination. And so we've used this, and this has become so ubiquitous. Now many of us have this on our phones. We don't go anywhere without consulting our phones to be able to get to a certain place. Well, I share that to say to you that I've had recently the most frustrating time having to get someplace. I often take my mother to the store and to various places. And my mother's kind of up there in age. And when I get in a car and she tells me where she wants to go, I put it in my navigational system. And my mother doesn't trust the navigational systems at all. And so while this lovely thing is trying to tell me the most direct way of getting to our destination, and it's built upon decades of science and billions of dollars of investment. My mother says no, she knows a better way of getting there. And she will often contradict what the navigational system is telling me to do. And so I can either listen to the navigational system or listen to my mom. And I tell you, every time I choose to listen to my mom, and it ends up making sure that we sometimes get lost and sometimes we don't get to our destination in the way that we thought we would be able to get to the destination. And I share that story to say to you that I've worked prevention in many, many places, and the science that Denny has shared with us and the investment of thought that Wadih has shared with us, the investment that Matej has shared with us, we have the science to really help us to achieve the destinations that we all seek. But I find that many communities are still operating as if they're like my mom's. They choose not to pay attention to the science and choose to do things kind of the way they've been used to doing it, often delaying the results that we're going to have. I want to share with you that choosing this random way is not the way of prevention. One of the things that I want to offer to you is that prevention is not random. In fact, what I will say to you is that our communities are perfectly engineered to produce the results that you are currently seeing. Nothing is happening in your communities by accident. It's all been produced by the conditions that we are identified and have identified within those communities. And therefore, our approach to addressing these issues cannot be random, but rather prevention has to be intentional. It has to be purposeful. It has to be strategic. And we have the science to help us and to allow for us to be able to be those three things. In fact, what it is that we build our science upon I believe, are built on three pillars of understanding that I choose to follow. One is the fact that we all kind of can agree that the most effective way of addressing any problem is to prevent the problem before it starts. Two, we believe in the full engagement and the empowerment of the community in both their roles of helping us to understand that problem and the context with which that problem is taking place, but also to be part of the solution to that problem. And as Denny shared so eloquently, being guided by science in order to achieve population level change. These are the three guideposts for those of us who are the practitioners, for those of us who are the implementers of the science that Denny and Wadih has offered to us. And part of what I want to offer to you are areas in which I think we may be able to do this a bit better. Right? I think there are four opportunities for us, clarifying our roles and how communities can work towards applying this prevention science. First and foremost, I think we can do a better job of translating the remarkable science that we've talked about this morning, but clarifying it on behalf of those communities that we serve. In other words, we can help our communities prioritize. We can't be all things to all folks. Secondly, I think it's important and incumbent upon us to help our communities learn how to focus locally. While our issues may be universal, the ways in which those issues and challenges come up within the context of our communities are dependent upon the communities that we identify. So we have to take the science that Wadih and Denny offered, but translate it so that it fits us locally. Thirdly, we need to be able to find our strategic leverage. And here's where Matej's book really comes into play. It really helps us to understand how to concretize and strategize the way in which we align the strategies so that it might have the greatest impact and effect upon us. And lastly, we want to ensure that this science is broadly accepted. So we need to engage our communities in this process of change effectively and equitably. So we have to become a bit of evangelists with respect to the science of prevention and help engage folks in this conversation of change. And so while we don't want to get into all the details of the book, there are three big ideas that I think, Matej, you extraordinarily presented to us in the book. First and foremost, it's been discussed already. Fear is not a strategy. Right? We can help our communities be able to understand this. And I think the reason we're speaking about these three items is because they're happening far too much, far too often, as it's still, even with all the science that we know. Secondly, we need to make sure that we understand that while information is good, information does not equal transformation. As Wadih so eloquently put with his example, even though we may know things, it doesn't translate to behavior changes that will help us to be able to produce the results we want to get. And lastly, we want to be sure to be able to understand that context matters as much as content, right? So we need to engage the broader community in things such as family management. And if we look at schools and how we're engaging in schools, as we look and engage the broader communities in this context of change, making sure that we're able to align our prevention strategies in these settings is vitally important to what it is that we are wanting to do. And so I just offer a few examples that we might want to consider, that you might want to consider, as well as we take this and put this within the context of the great information that Matej's book offers us. These are just three examples that I want to share with you. First and foremost, I think we need to make sure that we are emphasizing multi-year, multi-developmentally sequenced delivery systems, right? We move from scare tactics to understanding that skills are vitally important for us to be able to utilize. And we can put this within the context of the curricula that you might pay attention to. Secondly, we want to understand that one size fits all does not work for us. And so if we have shared frameworks, we can make sure that we can put that within the context to help those communities that are trying to achieve change, move away from these one-off events and make sure that we're able to help put in place science-based, evidence-based practices that will really enable change, even within low-income contexts that would be able to be supported by this. And lastly, being able to pair our prevention education within the classroom to more environmentally supported efforts. As Denny shared with us earlier, the environmental factors really is at that nexus in which we can actually have some great effect and great impact with the work that we do. So this is not merely about the work that's done in the classroom for our kids, but also ensuring that we are paying attention to the environment that really surrounds those behaviors of those young people in those classrooms. And so I really think about this when I talk about prevention and really the emphasis on prevention. For me, prevention is just like this protection that we put in place for my grandchild, right? That gate at the top of the stairs, right, is something that did not consider me at all, right? It does not consider the fact that I don't need the gate, but the gate is there to protect the most vulnerable within the context of that environment. That gate makes sure that we are making prevention blatant and obvious for those that are most importantly in need. And so with respect to that idea, what that shares with us is that prevention is really about identifying and prioritizing the most vulnerable within our population, identifying where they are most vulnerable. In other words, the environments that place them at greatest risk across the lifespan, and ensuring that we are making prevention obvious, right? Just like that gate at the top of the stairs makes an invisible vulnerability blatant and obvious. We need to consider those invisible vulnerabilities throughout the developmental lifespan, on developmental periods and processes, those developmental milestones that Danny shared and talked to us about, all require us to be attentive to making those invisible vulnerabilities blatant and obvious on behalf of those that we are serving. And so if we put this within the context of the remarkable resource that Matej has offered and shared with us, what we have is a way of navigating ourselves as we think about how do we implement the remarkable science. And so prevention gone wrong isn't about blaming, as Matej talked about earlier, really is, for me, going back to my navigational system analogy, about course correcting. And there are opportunities for us to course correct. If we pair accurate messaging with real skill building, with supportive environments, we can move from our prevention efforts being merely performative to being much more effective. And we can do this by making sure that we try to help our communities mitigate the things that are not working and scale what does work with fidelity and with the compassion that is necessary in order to make sure that it's aligned with the communities that we are serving. And so with respect to all of that, I'm gonna stop sharing now. I want to say it is an honor to be here with these remarkable global leaders in prevention to be able to have this conversation. But I want to turn the microphone back over to you, Cressida, for the remainder of our time.
Thank you so much for visualizing also what we have been talking basically the whole hour almost already. I think what you're saying is very much true. What you said in the end, it's not a failure per se. It's more about course correcting. That's why we don't want to discourage anyone who is here that feels like, oh, maybe I'm doing the wrong thing and maybe I should stop working on what I'm doing. That's not what we're at all saying. It's more about aligning it with the science that showcases what works and improving the services that we're working with. So thank you so much for highlighting that. I think that's that will help all of us as well. So I see we have already a few questions in the Q&A, and I see that both Wadih and Diana have been busy answering them already. But we will pose a few of them here in the debate as well, while we're also having some other questions potentially. So I see one of them is still open. It's from Laura Edwards, and I think it was already briefly mentioned earlier, but I still want to pose it here. It's what suggestions do you have for community partners who still want to do scare tactic events as prevention specialists working in and with communities? It's hard to go in and say that's a scare tactic, don't do that. So the floor is open. Any panelist can maybe join in and share a few cents on what you would suggest to this question. Maybe we can start with Diana.
I'll just say that there's been quite a lot of research on scare tactics of various types, from scared straight and dare and so forth, and they do not only do they not work, but I had mentioned the word before, iatrogenic. They're detrimental. They actually lead to worse outcomes. And there's a number of theories about why that occurs for kids, why it's sort of a challenge to them. Scared, I'm not scared. And it's, it doesn't impact the brain. I always say, in a good way, I always say that fear does not invoke the learning process. And I think that's the bottom line. It turns off learning, and it shuts down cognitive centers, so that people are not necessarily applying advantageous decision-making to their behavior. So if we can help people to understand that, these are just some of the practices that sounds logical. Doesn't to me, but to some people sounds logical, but it's actually very detrimental.
Thank you for sharing that. Anyone, do you want to add, Wadih?
Can I add a bit? Yes. I mean, it's always important to remember, like when we talk in terms of communication-based prevention, who are we talking to, right? There are people that are resolute non-users. They're not planning to use, they're not using now. There are people contemplating to use, and there are people like just started to initiate use. I mean, me as a prevention person, that's what I'll put myself in the shoes of Laura and like addressing it, right? I'm more concerned in terms of prevention from those contemplating use or like already like started using it, right? These two communities will not be deterred by a fear-based message. The decision is there. It had me something more than this. It's not what you're telling me that's going to deter me from using it. And the second thing is, like, if you don't deter me and I don't trust you, I lose my trust in you as an institution with this information for future-based messages that was not convincingly enough for me. So basically, both elements would be elements that Laura should use in terms of countering that argument moving forward.
I would only add to what has been said, that real change isn't occurring through fear, as Denny kind of mentioned. It happens through relationships. It happens through young people feeling attached, committed, to feeling bonded to. There's an extraordinary amount of information on mattering and how young people who feel as though they matter to those that are articulating, communicating those really, really clear standards and beliefs and healthy behaviors, how that makes the difference. And so if we can move away from and help our communities understand how to move away from the fear-based campaigns, which are sexy, right? But towards these things that really require a bit more investment of time, investment of care, investment of compassion, I think we will see a beginning of that needle beginning to move.
Thank you. I don't know, Matej, if you want to add something as well.
I think there are several chapters in the book actually addressing this fear-based messages, not just the chapter focusing exactly on this approach, because it's cross-cutting issue in different ineffective or iatrogenic interventions, building on fear and telling kids what not to do, somebody mentioned the common sense, I think, but that I should change a little bit the title of the book. But I really want, with this book, but also with all other activities, to make evidence-based prevention a common sense. So that's the direction, that's the final destination we need to come to, that when we speak about evidence-based prevention, that people say, okay, this is common sense. So we have to do this common sense thing, right? So that's our job as well, to make evidence-based prevention a common sense in the future decision-making processes by teachers, by parents, policymakers, whoever is responsible for prevention. Maybe
Yeah,
just this is just a short note.
But we want prevention to be part of our zeitgeist,
Mhm.
you know, in our drinking water. And it's not just preventing risks, as this points out. It's health promotion across the lifespan. It's about what we can do to nurture healthy relationships and feeling worthwhile, as Carlton was pointing out. Every child needs to feel worthwhile and loved and cared for, not only by caregivers, but by systems, by the structures in our societies. So it needs to really permeate every level.
Thank you. Thank you for those great answers to the question. Moving to the next, I think that's a very practical question, which maybe your input can immediately already kind of bridge that gap between the science that we're talking about to the practice. It's that an attendee is having an exhibition booth catered for students 7 to 16 years old. And even though it's only for a day, they kind of would like to ask some advice or suggestions on what they can do other than sharing just information on the dangers and harmful effects of drugs. I'd like to go first.
Maybe I can add something. What we usually advise, because in many cases there is a time limitation. There is a capacity limitation. So schools come and ask for, miracles. They were doing wrong things for decades, and then they want to change overnight or to change things in a very short period of time. But whenever we train some prevention intervention providers, we usually say that if you are limited with times, then focus on normative beliefs. Because in many cases, young people decide about risk behavior based on some wrong norms they have about alcohol use, tobacco use, whatever. If we are able to show them the real data, that's possible to change in a very short period of time. This is maybe one option if you are really limited by time and you're asked to do something in the school. So normative education could be a solution, but not forever. It's not like you are coming every year and speaking only about normative beliefs and normative education. There is another one which is also very important, to expose unethical practices of industry. This is also sometimes very important and effective intervention, because young people want to be rebellious. They want to be against the system, against the family, against the parents. They want to do their own way. And when we show them how industries manipulate with them, it might help at least with some. It's not. We could not harm anybody with this kind of information. That's also important from the ethical point of view. With normative education and with exposing unethical strategies of industry, we cannot do harm to anybody. This is something which we are on the safe side if we go somewhere and do something in a short term. So those two interventions might be a solution in this kind of situation, but we always need to put on the table with the school principals, with the administration authorities, that it is not enough, that we should start talking about more systematic, more strategic way of how we are going to build a prevention system at the community level or in the school or at the national level. So this could be just an entrance point with some short-term activities which might help, but then continue talking about more strategic and systematic interventions. I took a long time, so sorry. Sorry for that.
No, don't be. Anyone from the panel who would like to add to that?
I thought what Matej offered was so beautifully put. and right on the money, so to speak. The one thing that I would ask to consider if you have the opportunity to do this, if it fits with respect to the context, is that inviting and engaging other young people to be a part of the delivery of the messaging and the interacting with those young people, if they are indeed kind of trained and supported in the way of doing that, also can enhance the effect and the impact that you want to have with other young people receiving the messages that you're trying to convey. Young people listen to young people.
That is very true. Youth engagement is incredibly important in prevention efforts. Yes. All right. Another question I have, and this is more of an open question to all of you, and then also considering your experience in what field you're from. So in your experience, what is the most common so-called prevention gone wrong example you've encountered, and what did you learn from it, whether this is in implementation, in science, or in policy by member states? So maybe I'll go and start with Danny. If you have anything.
There's quite a few. There's quite a few. I mean, I think two come to mind right away. There's lots, but the less than high quality implementation of prevention strategies has led to them failing to produce desired outcomes. And then prevention gets unfunded because it appears not to work, whereas the strategy itself has been shown to be effective, but it's not being implemented with fidelity and with high quality, with monitoring, with refinement, or with adaptations for the community that it's being used in, whereas maybe it was tested in white rural communities and is now being administered in largely mixed urban communities. So that's a big flaw and a big fly in the ointment, as you would say. And also, the community needs to drive the strategy. We can't come in as experts and say, you need to do this. They need to drive it. They need to identify their own needs, cultures, preferences, values that map to what they think is most important and what would be acceptable to them. And then it will be embraced, and then it is much more likely to work well and benefit. But the way we do it oftentimes is not with that in mind. And we often are under grants that are going to run out and they're not sustained, and we're getting things in there. It's very well monitored during the grant activity, but when it comes to uptake by the community and practitioners in that community, it's not as well done as it was during the research process. And then another one, just really quickly, is when policy is rolled out that is completely inconsistent with science. And that's a particular thorn in my side, because it happens so often. For example, with recreational marijuana being legalized, and we're seeing the already adverse effects on adolescent use from that policy that was not attuned to that very large body of knowledge that could have predicted what would happen if we were to legalize recreational marijuana.
Thank you. That is indeed very true. Wadih, you would like to add from your perspective?
From my perspective, in the field of work that we see, the most common thing that we see from two examples, one ineffective, one iatrogenic. The most ineffective, not ineffective, but let's say misused modality of prevention is prevention through media, just advertising messages about the dangers of drugs, and reflecting this as the investment for prevention, with an effectiveness being reported in terms of reach, how many people have seen the ad, without any sort of information whether or not it's been effective or have changed anything. It's a big investment in a large, amount of money that could have been used in a much more effective way. From an iatrogenic perspective, meaning that interventions out of all good intentions have generated a kind of a negative and increased the risk or hidden increasing how much the drug use would be hidden and not reported is mandatory urine testing in schools. This we find out of all good intention, many being used as a preventive modality. So we ask schools, do you have drug use? Prevention strategy. We don't have drug use in our schools because we screen. Anybody who has drug use is kicked out. Fine. But from a prevention perspective, that person did not disappear from the radar. That person should be somewhere. Retention in school is important. Attachment is important. So basically, a preventive modality should be go deeper in terms of having that attachment modality to a social institution like the school, and the more the person is retained within that school, the more we can have a better positive potential for that person to kind of grow back and kind of be rewarded to the community. I will not have time to dwell into all of its details in terms of how to address it, but these are the two most common things that kind of tick the boxes in terms of most common ineffective or iatrogenic effect services we see. Back to you, Cressida.
Thank you, Wadih. Carlton.
A few come to mind immediately when you ask the question. One is an over-reliance, and it's been spoken to already, an over-reliance that I've found of communities with respect to information dissemination as being the only strategy that they utilize. As has been pointed out already, and I'm an example of you can know things and not do things. With respect to that, I am getting blinder and blinder the older I get, and I still refuse to wear glasses, as you can see here, because I have vanity. It's crazy, man. I know. It's crazy. It's just the way we are as human beings, and I find collectively as a community we often do that as well. The over-reliance on one-time events that has been discussed already, I think I just see it always kind of in various places. And so really being able to understand how to link those events to broader evidence-based practices that align with the standards that Wadih has spoken to is really important. Aligning those with broader environmental kind of strategies would be important. And the last thing I would share is this, a lack of awareness and a lack of understanding and a lack of focus, I would say, on environmental strategies and how and the effect and the impact of environmental strategies. We are so program focused in many cases. I refer to it as the difference in understanding the relevance of the numerator versus the denominator. We focus a great deal on things that might impact the numerator of our equation, but miss the denominator of our equation that environmental strategies often helps us to affect change with.
Thank you so much. And I think with that, there's like one thing that now Danny and also you, Carlton, mentioned is that I think many of the people probably listening here might struggle with is the fact that the limited grants that is often being worked with, the grants that need to be applied to, and they have certain conditions and requirements. You kind of have to form it towards that, and they might only be a year or two, and then it's always hard to have the uptake afterwards. So I think that might be a struggle as well. So do you have any like insights or tips for that, or that is just maybe just a downside of that we are working as a civil society oftentimes with grants that are rather limited? Just a few minutes, because I know we're close to the end, but I just triggered maybe an idea because it was kind of mentioned 2 times.
I will just put a sound by saying, like, in many cases, prevention is seen as something like a liability that, when there is resources, we invest in it. When there is no money, we don't invest in it. But I think it's very important to highlight the fact that not investing in prevention comes at a very high cost, much more than the cost of the prevention itself. And that's voice of science we're talking about is a top-down and a bottom-up voice of science. So while the science is there and we need to talk to policymakers to kind of invest, the role of civil society cannot be underestimated and cannot understated in this context in terms of mobilizing at the grassroots level what should be done, and getting the community together around the importance of that investment and how much it could give back with regard to development at the community and at the national level.
Thank you for that. I don't know if you want to add anything, Carlton, Denny, last few words.
I
No, I was
think,
just going to say, Wadih is so good. That was excellent.
yeah. Yeah, I think one of the problems for the reason why prevention is so underfunded and underappreciated is because policymakers don't see immediate outcomes. You know, prevention is invisible in their minds because it doesn't occur sometimes for years. You know, if you have a prevention program in kindergarten or first grade, you don't see the results for another 10, 15 years. But there are ways to track intermediate outcomes that are very powerful predictors of later behavior. And that's what prevention scientists should be highlighting is, yes, we want to prevent substance use by tackling these influential conditions early on, early in development, and we can track that. That can be measured and predictive of later, lesser drug use. And so I think that could compel them to fund it greater. They need to have that tangible, marker that something has happened because of their policy or this grant or that program. We all need to see that, but I think we miss sometimes the forest through the trees. Mm-hmm.
Yeah,
Thank you
great.
so much.
I would only just say that we're in this really, really interesting moment, I believe, where the work that everyone does here that's participating in this and attending this has never been more necessary, more needed than right now. Our ability to convey that and to engage others in this conversation has never been more important. And we've never had as many resources and as much information and know as much as we do at this point. And so we have such an extraordinary opportunity to really affect the climate changes that we have. And so for those reasons, I've never been more optimistic and more psyched about being a part of this incredible field that we're all a part of. And so again, thank you for the honor and the privilege of being a part of this conversation.
Thank you, Carlton. You took away my closing remarks, I would say, and that was very well summarized.
Stop that.
No, it was perfectly summarized, but I would like to, on this note, I would like to conclude today's webinar and thank you, Denny, Wadih, and Carlton as well, so Matej, for contributing to today's important discussion, and a discussion that is going to be continued for sure, because it's such an important one, and as Carlton said, it's an opportunity for future development of the science, but also the implementation of and the global and local collaboration among all of us. So I think with that, I think the word passion, Matej mentioned a few times today and also others, we can see that all our panelists have been very passionate about the topic. So passion is definitely an important part of prevention, but it cannot exist without the science that was being highlighted today. So based on that, I think we all can work towards the further collaboration to make sure that this comprehensive system of care is being strengthened, is being built, and also that the protective factors are being enhanced, and that we support the individuals and communities so that we all together learn and listen to the science and reflect on what hasn't worked, and also keep improving our own efforts in the future from tomorrow onwards. Matej, I don't know if you want to say a last few words as well on your behalf.
Yeah, I would also like to thank Miguel for translation, for Spanish translation. So we were able also to offer this webinar to Spanish-speaking colleagues and community. So thank you for that. And I think it's more or less just a starting point to maybe to continue with similar webinars to promote more evidence-based prevention from different points of view, different perspectives. And I also want to announce that there are several translations coming of my book. So Arabic version is coming very soon. Italian version is now on the way as well. Hopefully Spanish will be available also soon. So people are getting interested also in translating the book, which means that those messages will be spread even more than only with English version or with this kind of webinars. So I look forward to even maybe more such a webinars, maybe in different languages in the future.
Wonderful. Thank you so
for
much.
inspiring us, Matej, through your book.
Indeed.
Thank you
Thank
for all
you.
your kind words and forward and reviews and all of this helps at the end in promoting evidence-based prevention. So definitely every word is worthy. Thank you.
Thank you so much. And thank you for everyone joining us here today, for your time out of your precious day and learning together with us. And we hope to welcome you again in a future webinar. So yeah, thank you so much and wishing you a wonderful day, afternoon, evening ahead.
Thank you.
Till
So
next
good to
time.
see
Thank you,
everyone.
everyone.
so
Lovely
much,
joining you
Cressida.
all.
Bye-bye. Thank
Great
you.
job, Cressida. Thank you.
Thanks. Bye.
Ciao.